marketing has become very popular recently, and especially health content marketing. As a leader of a health company or health practice, there may be some conflicting stories that you've heard about content marketing and its value for your business. So today, I want to clear up 3 of the biggest misconceptions that I hear about healthcare or medical content marketing. First off, if we haven't met before, I'm NICHOLE. I'm a public health pharmacist turned healthcare copywriter and content strategist, and I help innovative health companies develop and execute culturally relevant content strategies that help them increase their brand loyalty, establish themselves as thought leaders and disruptors in the healthcare industry, and help improve their patients' health outcomes. If you are interested in more health content marketing tips, subscribe to the channel and click the notification bell so that you know when new videos, new content marketing tips are available for you. Myth number 1. Content marketing does not get you a return on your investment. It could not be further from the truth. Let me explain why. Here is the basis of how content marketing from an SEO or search engine optimization perspective works. The goal is to increase traffic to your platform, whether it's your website or your social media channels. Increase traffic. Convert that traffic into highly qualified leads, and then convert those highly qualified leads into sales, patients, clients, or customers. If your content marketing is effective, if it follows that 3-step process as it should, you will most definitely get a return on your investment, because the traffic that you build from your content is directly leading to more sales, sales that you would not have had if you had not been engaging in content marketing. But, and here's a big but, if your content is just content, if it's just content for the sake of content, like there's no strategy, there's no SEO element to it, you probably will not get a return on your investment, because at that point, it's just content. It's not content marketing. There's a big difference. A content marketing colleague, Julia McCoy, explained it best when she put it like this: content marketing is a vehicle, and content marketing strategy is the fuel. Without the strategy, without the very intentional approach to content marketing, you will not reach your destination. Your car, your vehicle will not reach its destination without the strategy to fuel the content marketing machine. When you begin working with a content marketer, they should be able to explain to you upfront exactly how their marketing strategy is going to result in a return on your investment. They should be able to estimate the conversion rate between the steps that we mentioned: increasing traffic, converting traffic to leads, converting leads to sales. That can give you a concrete look into what the return on your investment might look like. When you invest in content marketing, in legitimate health content marketing, you will absolutely get a return on your investment. Misconception number 2. You can successfully DIY health content marketing. Listen, I'm a pharmacist, so I know that if you are a healthcare professional, you have the medical, scientific, academic qualifications, knowledge, and expertise to be able to explain health concepts. That is hands down a fact. But that is not the entirety of what health content and health content marketing is about. Being able to explain a concept is different from being able to explain a concept to an audience who has no medical or scientific background in a way that is interesting and engaging and keeps their attention, and in a way that makes it easy for them to read, engage, share, post, comment, like. Those are very different skill sets, and that's where you need someone with a content marketing background to help you convert that knowledge that you have into something that is usable and relevant to the end user. Anytime I worked with a client who was previously DIYing their health content, at least one of these 3 factors was missing. They were either not able to frame the information in a way that was understandable to the general public, their content did not adhere to generally accepted guidelines of writing online, or frankly, the content was just not positioned in a way that was interesting. It is possible to DIY your health content if you have no other options, but understand that that is not the same thing as health content marketing, and you are probably not going to have the same results. It's not going to be as effective because you don't have the content marketing strategy behind it. Honestly, your time could be better used elsewhere. Your time is much more valuable doing other things in your business, in your company, than trying to do health content marketing if you don't have that background. So when you outsource content marketing to someone who is an expert in it, you free up your own time, you free up your staff's time, and you ensure that you get that return on the investment that you're looking for. Misconception number 3. Health content is one size fits all. You are well aware that different groups of people have different priorities when it comes to health. They have different health statuses. They have different beliefs about health, different medical conditions, different risk factors, insurance status, health literacy. There are all of these elements that are a part of someone's health that are so different from one person to the next and even from one demographic to the next. So if you are creating homogenous health content that's like blanket content for everyone, I guarantee you it's not as effective or transformative as it could be. In fact, when it comes to content, a one-size-fits-all approach goes directly against one of the core elements of marketing, which is segmentation and targeting. Segmenting your audience based on specific characteristics and creating content that caters to those individual segments. Your health content also needs to be targeted and specific and culturally relevant based on the type of audience you are trying to convey information to, based on the audience you want to act on that information. When you tailor your health content to specific audiences, the chances of you promoting action and increasing loyalty to your health brand are much higher. Hopefully you learned something meaningful and factual about health content today. Now, I would love the chance to hear from you. If you go to megannicole.as.me/content, by the way, that link is in the description box, you can set up a meet and greet chat and we can discuss how health content marketing might benefit your health company or your health practice. So if you want to chat about your company or practice's needs and whether the quarterly content subscription might be a great fit, make sure to click that link. I'll see you guys next Thursday.